afternoon or good evening, depending on where you are. Welcome and thank you for joining us this evening. I'm Lucas Swanepoel, I'm Director of Government Relations with Catholic Health Association. This evening, we're going to go through a little bit about what Catholic Health Association has been doing and some of the the priorities that we see at the current time and looking into the current Congress. Before we get going, I think it's important we take a moment to just pray, reflect, particularly in this time of COVID, when so many of our health providers have experienced so many tragedies and challenges, when our communities have experienced such hardship and so much loss of life, that we take a moment to reflect, to pray for those who have suffered from coronavirus. So I will pray. Close your eyes and just reflect. Merciful God, hear our fervent prayer for all who suffer from the coronavirus. May those who are infected receive the proper treatment and the comfort of your healing presence. May their caregivers, families, and neighbors be shielded from the onslaught of the virus. Give solace to those who grieve the loss of loved ones. Protect and guide those who strive to find a cure, that their work may conquer the disease and restore communities to wholeness and health. Help us to rise above fear. We ask all of this through the intercession of Our Lady of Lourdes, in the name of your Son, Jesus, and the Holy Spirit, now and forever. Amen. Well, what I want to do today is go a little bit quickly about who Catholic Health Association is, what we do, some of our priorities for Congress, and then some of the particular priorities that Catholic Health is working on related to racism and achieving health equity. And I'm joined today by a number of my colleagues in the advocacy department. And you'll see on the slide now the full team, but I'm joined today by Kathy Curran, who is our Senior Director of Public Policy, Clay Odell, who's the Director of Advocacy, Indus Bernardi, our Director of Advocacy and Resource Development, and Paulo Pontemayor, Director of Government Relations. And so we have everything from people who prepare a lot of the data and background that we do related to social determinants, the policy development, but also those of us who go to the Hill and bring that message to members of Congress on a daily basis. So to get it going, I will turn it over to Indu, who will take you a little bit through who Catholic Health Association is, some of our history, and what really brings us to our work. Indu, go ahead.
Thanks, Luke. I'm going to share a little bit about the organization. The Catholic Health Ministry traces its beginnings to the Ursuline Sisters of New Orleans, who first came to this country almost 300 years ago today, to address the many pressing social needs in the new territory. As the country grew, so did the Catholic Health Ministry, with religious orders continuing to respond to the calls of communities. They established not only hospitals, but orphanages and schools, which often serve the most vulnerable. The Catholic Health Association was officially established in 1915 as the Catholic Hospital Association. The goal of this organization was to ensure that as Catholic hospitals adapted to the new ways of delivering care, that they also stayed true to their mission and identity. And while healthcare has continued to change dramatically since our founding, CHA remains dedicated to fulfilling that goal through its work in mission, ethics, and advocacy. Next slide. This slide shows you what Catholic healthcare looks like today. The ministry has great reach and impact through the care it provides and the people it employs. Every day, more than 1 in 7 patients is provided care in a Catholic hospital. The ministry is present across the country, providing care through hospitals, long-term care facilities, and other types of healthcare organizations. This presence gives us a powerful voice in advocacy, which my colleague Clay Odell will be talking to next.
Good evening, everyone. I'm going to talk to you a little bit about our advocacy priorities and what are the things that we expect to be working on in the next Congress. What you're seeing now are what we call our vision document. It's our vision for healthcare in the United States, and that's some of the principles that our ministry has laid out as being the foundation of what we think the U.S. healthcare system should be. These are very high high-level principles. They aren't specific to any particular Congress or administration. We think that they are, or we say that they're the foundation document of our healthcare ministry in terms of what we want to see. And above and beyond everything, the Catholic Health Association and the Catholic Health Ministry believes that everyone in the nation should have access to quality and affordable health care. That has always been our #1 priority. It remains our #1 priority and probably will be for, unfortunately, several years until it happens, but we're hopeful that one day it will. We base these, our vision and the principles in them on Catholic social teaching, and that's why we say it's a high-level document that stays the same from Congress to Congress and guides all of our advocacy efforts. When we do get down to the specifics of what we do, and we can go to the next slide for that, we talk about some of the more down-to-earth issues that come up from Congress to Congress. And every Congress that we encounter, we have a new Congress that just came in now, we do a 2-year advocacy agenda to focus specifically on what we think is going to happen and what we would like to happen. So if we can go to that slide, Luke, on the advocacy priorities, we'll show you some of the things that we anticipate happening. We're right now in the process of getting our advocacy agenda finalized. We have a process where we go to our members and talk about what they are experiencing and what they think is going to happen in the next Congress and what they would like to see. Several things stay the same from Congress to Congress. Some things change, obviously, with a new administration, a new Congress. Our focus can change, but we do maintain very much the same sort of high-level priorities. And as you can see at the very top of that, ensuring access, coverage, and affordable care for everyone. So that, again, remains really our top priority. We also have another priority about maintaining a strong safety net. CHA is a very strong defender of safety net providers, particularly the Medicaid program. We do a lot of advocacy on that to make sure that the vulnerable populations in our nation have access to quality and affordable care. Strengthening aging and chronic care services. We have long-term care facilities and providers in our ministry, and that's a very important part of it. It's a very important part of our mission and our past, and continues to be a very important part of what Catholic healthcare provides to the nation. So that's another one of our priorities. Protecting life and insurance conscience protections. As Catholic organizations, obviously we have, as Indu was saying earlier, a particular mission and identity, and the Catholic Health Association likes to make sure in its advocacy work that our members, our ministry, are able to protect that mission and identity, as well as being full participating members of the U.S. healthcare system. Improving the health and well-being of communities is a very important part of our ministry as well. The Catholic Health Ministry has a lot in common with many of the other healthcare providers, nonprofit, for-profit, different types of providers throughout the country. But we also have that unique mission and identity, and a lot of that comes into this advocacy priority. Before I get a little bit more into that, I'll note the very last one about disparities in healthcare, because that's something that we're very much focused on in this new advocacy agenda, and that you'll hear a little bit more about in this presentation. But back to improving the health and well-being of communities, the Catholic Health Association and our members are very much focused on many of the things that you out there are working on, and we work with many of you on those issues. One of the buzzwords in healthcare that we hear a lot about are the social determinants of health. And what we mean by that are the various issues that can affect the health of individuals and communities, things like the environment, things like nutrition, things like housing. And those things definitely have an effect on health. So we are very much focused on making sure that people have adequate housing, adequate nutrition, a good environment, but we're not just focused on it just because it intersects with health. We're focused on it as a social justice issue as well. It's what people need to be able to function in society, to be able to fulfill their mission in life. And so we work, like I said, with so many of you out there on those issues. One of the other issues that we work in this area is immigration. And again, that work that intersects with health. We strongly advocate access to healthcare for everyone, regardless of immigration status. But we also weigh in and do advocacy work on comprehensive immigration reform, the DACA program, border and migration issues, because again, those are all social justice issues where we work closely with our Catholic partners to make sure that those are at the forefront of our advocacy work. And then lastly, I would mention, as I said, the environment. That's another one of our advocacy priorities. Again, it intersects with health, absolutely. A good environment can affect health, and a bad environment can affect health. But we also look on it as an issue of social justice in terms of being good stewards of our shared planet. So those are some of our advocacy priorities. As I said before, we are going to finalize our advocacy agenda for the next Congress, for this Congress, 117th Congress. By the end of February, we'll have that on our website. Our vision document is on our website. Our advocacy agenda will be on the website, as well as what we call policy briefs. And these delve a little bit further down into some of these issues, and will give you some idea of where CHA is weighing in on particular bills and administration policies and regulatory policies, some of the more nitty gritty that comes up, and we update those throughout the 2-year period. So I encourage you to visit our website and look at our advocacy resources and use them as you need. And with that, I'll turn it over to Paulo.
Great, thanks, Clay. Just a quick reminder to everyone, some little housekeeping. So please, as you are thinking through our presentation, and if you have questions, please put them in the Q&A box. We'll get to as many at the end. And you know, we want to make sure that we make this as interactive as possible. So please think about those questions. And so I will be talking about, you know, one of the most front of mind, most interesting, most unique things that this Congress is going to begin with, which is a current COVID-19 stimulus package that they're developing as we speak. You know, breaking news, one of the House committees actually released the language that they plan on marking up, and included in that is several health priorities and social determinants of health priorities that we've been pushing for. But our full letter that we sent the last week of January, it gives kind of a rundown of all of our big asks. You know, Congress has done a lot of work the past year, passing 4 comprehensive COVID response bills. And so we have really been pushing Congress to continue their work to support many of our members, the frontline providers in all communities, both rural, urban, and suburban, to continue to provide the care and compassion that many of the communities that we serve are going through. And included in this is really additional resources, not only for testing and personal protective equipment, but issues related to the Provider Relief Fund, which allow many of our hospitals, long-term care organizations, healthcare clinics, and other healthcare organizations to function. And included in this is really another big ask. President Biden has made it a cornerstone of his response plan, which is putting together a plan and federal resources to ensure that everyone who needs a vaccine can get a vaccine. And we want to make sure that once they do this, that we are doing it in an equitable fashion and using available data to make sure that those who are hardest hit are also prioritized. One of the other things that we have been pushing for as an organization representing healthcare providers is the idea that people that we serve, beneficiaries, people who enter our facilities, continue to have access to their healthcare coverage. And we also want to make sure that those who have lost their job-related health insurance, or who have lost coverage by, through the economic crisis or any other issues related to that, are given new resources and tools to get healthcare coverage. Going on what Clay had mentioned, we as a healthcare association also are very focused on addressing health disparities as it relates to this COVID crisis and this economic crisis, and really the reckoning around racial justice in the country this last year. We also want to make sure that immigrant families are continued to be protected. We're very hopeful that in this package, necessary resources for healthcare do not exclude individuals and families just because of their immigration status. So we will be pushing for that. In terms of the social safety net, we partnered very closely with some of the other Catholic organizations represented here at the Catholic Social Ministry Gathering related to food, housing, and economic livelihood initiatives that everyone is pushing. We want to make sure that not only is there a healthcare component, but there really is a social safety net as well as social determinants of health component. And our last piece, maternal care, behavioral health, and palliative care, are things that we truly believe are things that make us unique in the world of healthcare and hospitals, in the sense that these are services that we, as a membership and as a ministry, really do very well in the communities that we serve. So we ask Congress to ensure that these 3 priorities also get included in a final bill. We're hopeful in the next 2 weeks that language will continue to be developed that includes many of our priorities. The House leadership has indicated that they want to move forward in 2 weeks with a bill. We do not know what the Senate schedule is going to look like, but we know that there is a deadline in March of unemployment insurance expiring. So I know that when Congress is given a deadline, that's when they choose to act. Our full letter is available at this link, and it's also on our website if anyone wants to use it as part of their Hill visits or as a way to promote some of the initiatives that we're pushing forward. And I'd like to now turn it over to Kathy, who will talk about one of our exciting initiatives that we have just recently launched.
Okay, that was a rookie mistake. Didn't take myself off mute. You'd think I'd know better by now. Thanks everyone. It's great to be here. Looking forward to next year when we can all see each other in person. But what I wanted to talk to you a little about is the work that we've been doing lately around systemic racism and health equity. So as you all know, as the data on COVID-19 started to become available, it quickly became clear that some communities were suffering more than others. Racial and ethnic minority communities had higher rates of infection, higher rates of hospitalization, higher rates of death. Both the CDC and other data sources have shown this throughout the pandemic, with right now hospitalization rates among communities of color at about 4 times the rate of the white population, and death rates almost 3 times the rates in the white population. And the early data we have about vaccine administration is also showing disparities. There's only about 23 states are sending in data, and it's not all complete, but we are seeing that communities of color that are suffering more from the coronavirus are having slower rates of vaccination. And part of that, of course, is because of trust issues in those communities. And we're hoping to be able to work with those communities to build trust in the healthcare system. But this shouldn't have been surprising to us, because the existence of health disparities is something we've been aware of for years. I mean, there's loads of statistics out there. Racial and ethnic minority populations have less access to needed healthcare than do white people. Hispanics, Blacks, American Indians, and Alaska Natives are more likely to delay or go without needed care. They're more likely to be uninsured compared to whites, even despite the expansions under the Affordable Care Act. They also suffer from poor health and worse health outcomes. In addition to the statistics on the PowerPoint, we also know that Blacks, Hispanics, and American Indians and Alaska Natives are more likely to report a range of health conditions, including asthma and diabetes. American Indians and Alaska Natives have higher rates of heart disease compared to whites. So you could go on and catalog many of these. And the existence of all these disparities is one of the reasons minorities have been more vulnerable to the coronavirus, because it takes a greater toll, as we know, on people who already have poor health conditions. Now, Many in our members in Catholic Healthcare and we at CHA have been aware of and working on these issues for a long time. But because of coronavirus and because of what happened, particularly, the series of violent deaths at the hands of police that occurred over the summer, that all kind of brought to a head the issue publicly. And so in July, in the face of all these realities, this Catholic Health Association board committed the Catholic Health Ministry to working together to address racism in health. Many, if not all of our members have been working on this in many, many different ways and all these issues, but it was time for us as Catholic Health Ministry to come together and be a leader in this and bring our efforts together. It's part of who we are as Catholic healthcare. So the board developed and signed off on in a resolution what we call our pledge. It's our Confronting Systemic Racism by Addressing Health Equity pledge. And as you see, it has 4 elements. The most immediate element is immediate action to achieve COVID-19 health equity. So working to make sure that we're trying to write some of those statistics that I just gave to you. And then in terms of working against systemic racism and looking for systemic change, there are 3 elements to that. Putting our own house in order, which means looking internally at how we hire, how we promote. Again, things we've been doing already, but we need to step it up. We need to really recommit to these issues. Looking at, even though health is only determined, what happens in a hospital only determines a part of an individual's health, but it's still important to be looking inside our hospitals and identify, are there areas of health disparities that we can identify and we can fix? We need to step up our cultural competency programming for our employees, and also many of our systems have already undertaken and will undertake programs in unconscious bias to make sure that we are welcoming and not in any inadvertent ways discriminating against our patients. Also, building right and just relationships with our communities is an important piece of this. Through our community benefit programming, we already do have good relationships with many community groups, but this calls us to bring it to a next level and move beyond just reaching out and saying, oh, give us some information and maybe we'll factor it into what we do, but really building meaningful, just relationships with the people in our community, truly inviting them in to be with us, not so that we're doing for them, but to be with us and show us what their needs are and help us to really understand the needs of the community. And then finally, advocating change to end health disparities and systemic racism. Continuing the advocacy work that Paolo and Clay have referenced, really working with members of Congress, working with the new administration to seek out the kind of policy changes that we can enact or put into place that will address health disparities and work for for ending racism, but also taking a hard look at the policies that are there already that are where systemic racism has become entrenched. Maybe we don't recognize that these policies came from or are creating racist conditions, but we need to take a look at them and really understand the outcomes. And for our members, probably even more importantly, that means looking at their local and state policies to look for the places where racism has sort of become entrenched and what can we do to change that. So that is our Confronting Racism by Addressing Health Equity program. 23 of our members have pledged to this, 23 of our largest members, and the rest are also will be coming on. We kicked off the pledge and the initiative publicly last week on February 4th. If you go to our website, you can find materials about the initiative and you can look at a recording of that event. The website is wearecalled.org. There's also an opportunity for individuals to sign up and say, yes, I'm interested in your work. Please keep me involved and informed. So we encourage you to sign up on our website. So I'm going to, now we want to share with you the Confronting Racism by Achieving Health Equity video that we've put together. So I will be quiet so you can hear. While Lucas is working on the audio, I'll just tell you, as I said, this is on our website. There's a couple of different videos for you to take a look at, as well as resources that explain the problem of systemic racism and health inequity, and information about things that our members are doing. And we'll be building that website as we go along. And in addition to asking you to sign up to be connected through email through the website, I'd also like to encourage you to send us what you all are doing. Part of, as I said, this is an effort to bring the Catholic Health Ministry together as Catholic Healthcare, but we're going to be working with our Catholic partners at the Bishops' Conference, at Catholic Charities, local agencies, and CCUSA. So please share with us what you're doing in ways that we can partner with you. And let's see if we've got the audio going.
We are called to heal, to unite, to justice. Together, as Catholic Health Ministry, commit with us to confront racism by achieving health equity. When we say achieve health equity, what do we mean? Equity is different than equality, since no two people need the exact same things to be healthy. Health equity means that every single person has a fair and just opportunity to be as healthy as possible. Everyone must have access to high-quality healthcare services, and we must remove the economic and social obstacles to health, such as poverty and discrimination. After all, it's hard to be as healthy as possible if you don't have access to jobs that offer living wages, health insurance, and paid time off. Quality daycare and schools, safe neighborhoods with affordable homes and green spaces for recreation, fair lending, and affordable non-discriminatory access to healthcare and preventative services. And to understand how good jobs, fair banking, education, and other social factors contribute to a lack of health equity, understanding their systemic nature is important. Systemic or institutional racism is race-based, unfair treatment built into policies, laws, and practices. Housing provides one of the clearest examples. One case is the Levittown suburban housing project of the late 1940s. Through government loan programs, new homeowners could buy a Levittown home in a beautifully planned suburban community with little or no down payment. But there was a catch. Only whites could buy them, even though federal loan dollars were involved. Deeds included covenants requiring that they only be sold or rented to whites. The impact of home ownership in neighborhoods such as Levittown allowed white families to build generational wealth in healthy neighborhoods where property values grew. Denied home ownership outwardly, or faced with redlining, or denial of financial services based on racial or ethnic composition of their neighborhood, people of color faced overwhelming obstacles to make the same home investments as whites. Facing our country's past and present is necessary as we look at what's happening in our own healthcare systems. While no one may be intentionally or overtly denied care because of the color of their skin, health disparities exist. Is our own house in order? Does unconscious bias determine outcomes? When do communication and language barriers prevent diagnosis and quality care? Do cultural differences between patients and providers lead to misunderstanding or mistrust? How does our own lack of diversity in leadership and management impact care? Do we invest enough in our communities to improve economic opportunities? As Father Brian Massengale reminds us, this is about our very integrity. The impact of racism has got to become real to us, something that we have a stake and investment in overcoming. It can't just affect those people. I have to realize how it affects me and my integrity. Our Catholic social tradition compels us to uphold the dignity of the human person and promote the common good. Join Catholic Health Ministry to confront racism by achieving health equity. Sign the pledge to register your commitment to righting disparities in COVID response and changing our own practices and policies to build diversity, instill cultural competence, and earn trust. We are called to heal our communities, to unite for systemic change, to achieve justice for all.
So while Lucas is dealing with the slides, I just wanted to thank folks for being here today. This video is on our website. We'll be doing a version of the video that doesn't refer to the pledge. We initially did this targeting for our members, but there'll be a version with a slightly different ending. So if this is something that you think would be helpful in the work that you do, you're certainly very welcome to show it. If you're interested in reaching out to your, if there's a local Catholic hospital or health system in your area, you can let us know or be in touch with them. Lucas, do we have any final words you wanted to offer?
Yes, I mean, we have if you want to answer at least one of the questions, if not, for those of you who had questions or have follow-up, please go to our website, go to the CHA, Catholic Health Association USA website. You will there see a lot of our advocacy related positions. I know there's a question related to some of our environmental advocacy. You'll see an entire section related to environmental advocacy and things that we are doing here in Washington, D.C., but also the whole Catholic Health Ministry. And also just a reminder that to follow us on Twitter, Facebook, and Instagram as the We Are Called US begins to kind of roll out. I mean, we only launched it last week, so this is really the beginning of it, but this is going to go on for a number of years. So again, it's an opportunity to join in as this continues to grow, and we bring in more partners and we begin to work with more people more broadly. And I don't know if you had time for one question, and anybody want to answer one more?
While you're waiting, Lucas, I just wanted to say to people they're also welcome to contact us directly. And our email addresses you can find on our website, but the format of our email address is first initial last name @chausa.org. So if you wanted to learn more about something that any one of us talked about, please feel free to contact us that way.
And I'll just answer. There was one that related to, I think this kind of goes to Paulo and Clay's presentation related to employer-based healthcare coverage and those who lost it. If you see the link in the presentation, but again, at our website, you'll see a deeper dive on those larger priorities that Clay and Paulo discussed, which talks very specifically about the issue of employer-based healthcare. So things like COBRA coverage, things like Medicaid coverage, things like bolstering the ACA are all part of that larger COVID ask. So if you have questions about that or related to other programs that we didn't get a chance to discuss today, please go to our website, email us, follow up. Again, we're happy to answer it any way we can. And again, thanks for joining us. And we look forward to next year doing this in person so we have more time. I think having done a number of Catholic social ministry gatherings, the virtual is one way to get information relayed, but it's not the same as being able to sit and chat with you all or to have conversations offline to really discuss some of the challenges we're seeing. I mean, as we see with COVID, it's such a giant thing we are taking on as a country, as Catholic Health. So to try to boil it down to 30 minutes is definitely difficult. So I apologize if we didn't get to your questions, but again, please follow up with us individually if you have time. And again, thank you to Indu, to Kathy, to Paulo, to Clay for taking the time and joining us today. And thank you to all of you for joining us. Thanks for, hopefully you have successful days tomorrow on the Hill. Thank you and God bless and have a good evening.